Welcome to Transcultural Communications, Chapter 8, Basic Transcultural Communication Techniques. In the earlier chapters, they focused primarily on the theory underlying transcultural communication. This chapter will teach you basic transcultural communication techniques that you can use as you work with patients. The importance of clear, sensitive communication during these interactions with patients cannot be overstated. Clear communication is paramount to a harmonious relationship, especially when you and the patient are from very different cultural backgrounds. This chapter will teach you the basics of communicating successfully with patients from other cultures. You will learn how to initiate and build a transcultural therapeutic relationship. You will develop basic transcultural communication skills and perfect specific transcultural communication techniques. Building a therapeutic relationship can take days, weeks, or months. Every relationship evolves at its own pace. A therapeutic relationship is an interaction that will help a patient heal, both physically and emotionally. It is based on a professional relationship between a healthcare provider and a patient, focused on helping the patient solve problems and achieve certain wellness, mutually agreed upon, health-related goals. It will also help successfully implement the healthcare process of assessment, diagnose, planning treatment, implementing treatment, and evaluating progress. This relationship lasts only as long as the patient requires help in meeting healthcare-related goals. The basic foundation of a therapeutic relationship is therapeutic communication. Therapeutic communication is goal-oriented. The goals of transcultural therapeutic communication are to help patients from different cultures. These goals explore their life experiences, values, and belief systems, as well as their reactions to illness and treatment. They establish realistic, culturally accepted health-related goals, and they also take action that will benefit the physical and mental health while staying within their personal and cultural values. Establishing a therapeutic relationship may take days, weeks, or even months. As do all relationships, a therapeutic relationship evolves through different phases. There are 4 major phases of a therapeutic relationship. Let's take a look at the first one. This phase is the pre-interaction phase. In this phase, you learn what you can about the patient before you meet them. You review their medical record, note any previous hospitalizations and procedures, identify the symptoms that have brought the patient to you, speak to anyone who may have already cared for or treated the patient in a previous visit, especially information about emotional state or cultural background. Keep in mind that any preconceived negative feelings that you may have about a patient can hinder the development of the therapeutic relationship. Patients are individuals who may not fit any stereotypes we may have about a culture. The next phase of developing a transcultural relationship is the orientation phase. During the orientation phase, you need to continue gathering information about your patient's history and current problems. This is also a time to perform a physical, psychosocial, and cultural assessment. Throughout the orientation phase, it is important to show the patient respect and to establish trust and rapport. Also let the patient know that confidentiality will only be shared with individuals who are directly involved in their care. The next phase is the working phase. As soon as you and the patient have established a therapeutic relationship is when the working phase begins. Now you can begin to assess the person's concerns, strengths, and weaknesses, establish expectations and responsibilities, decide on mutually agreed upon goals, establish a plan of action that works for a healthcare provider and the patient, set limits, and discuss a time frame. Encourage the patient to openly discuss fears, feelings, and frustrations. The last phase of the development of a transcultural relationship is the termination phase. A therapeutic relationship may be terminated for a variety of reasons. The patient may be discharged, or the healthcare professional may change services, or the patient's health goals may be met. Regardless of the reason for termination, it should not come as a surprise to the patient. Remember that one of the tasks of the orientation phase is to set a time frame for the relationship and to make certain that the patient understands that the relationship will eventually end. So the determination or the termination process needs to be initiated in the orientation phase. During the termination phase, your major tasks are to outline the patient's strengths and discuss progress that the patient has made under your care, to review areas for improvement, discuss new goals and develop a plan of self-care for the patient, and discuss any feelings the patient may have about terminating your relationship. Since the 1980s, thousands of immigrants requiring medical and professional health services have arrived in the United States. To work with these cultural diverse groups of patients, healthcare professionals need strong transcultural communication skills. They must know how to communicate clearly with people who speak different languages and those cultural backgrounds, values, lifestyles, and traditions, and how they differ from our own. Although we cannot be knowledgeable about every cultural group, it is important to identify the cultural variations that could affect your communication with patients. For example, you should recognize that people from different cultures have different perceptions of illness and treatment, have different ways of interacting with healthcare workers, have different expectations for appropriate verbal and nonverbal communications, and may communicate pain, fear, and needs in different ways. Remember that talking with relative strangers about deeply personal issues is never easy, and it can be particularly difficult for patients who are from different cultural backgrounds than it would be for the healthcare professional. To encourage patients to talk to you about themselves, you must first convey empathy, which means you understand their feelings while maintaining your objectivity. It is not the same as sympathy, which is when you feel sorry for someone. Empathy is when you enter another person's emotional experience. If you do not show empathy, this can create distance between you and your patient. Patients also want and need to be treated with respect. Respect is more than simply accepting another person. Respect is valuing another person and viewing the individual as special. To help patients feel that you respect them, begin by interacting with patients in a normal manner. It is also important to show respect for a patient's personal space and status. Enabling patients to observe their religious practices and holidays also demonstrates respect. Asians, Hispanics, and older people prefer a more formal manner when dealing with healthcare issues. Address them as Mr. or Mrs. X, unless they give you permission to be less formal. Trust involves having confidence or faith in another person. Trust is a vital component of the healthcare professional's therapeutic relationship. Patients who trust you will feel confident that you will watch after their best interest and that you will respect their rights to privacy and confidentiality. Patients will also feel comfortable discussing their symptoms with you and even disclosing intimate details of their lives. However, culture can influence how many personal details a patient is willing to share with their care providers. For example, Asians typically value a subtle approach to the discussion of problems, and they tend to restrain the expression of strong feelings. Thus, Asian patients may find it difficult to speak openly with the healthcare provider about mental health problems, and they may tend to express emotional distress in terms of physical complaints. Patients who have encountered abuse in their lives may be distrustful of any authority figures, including healthcare workers. Establishing rapport, which is a warmth and friendliness that the two people are comfortable with each other. You can help build rapport by discussing non-healthcare related information with a patient. This will help gain the patient's trust and acceptance. Sometimes admitting that you have a similar issue can build trust. For example, insomnia. Active listening consists of giving verbal and nonverbal cues that communicate that you're interested in the patient. When you actively listen to your patient, you build trust and show respect. The acronym SOLAR is sometimes used to describe the techniques that promote active listening. The first part of the SOLAR acronym is to sit facing the patient. It implies interest in the patient and what they have to say. The O in the acronym implies open posture. Hands in your lap or on your notebook, legs crossed. This posture is non-threatening and non-authoritative. Avoid defensive or aggressive postures. Hands on hips or arms crossed. Next, lean toward the patient while they talk. This demonstrates and conveys concern and interest. It is important to have eye contact, which conveys interest, whereas lack of eye contact demonstrates lack of interest or, even worse, disrespect. You must also be friendly. Eye contact without friendliness could be perceived as aggressive or disapproval. Different cultures react differently to eye contact, so be aware of how the patient responds. And then it's important to relax. Be comfortable and smile in a friendly way. Providing a patient with feedback or information concerning a modifiable behavior, such as disregarding instructions, can help the person change their behavior. However, there are points to remember about feedback. Describe the behavior. Don't criticize the patient. Be specific. Focus on the details of the behavior. Focus on behaviors that the patient can modify. Provide information, not advice. And provide feedback in a timely manner, as soon as the behavior is recognized or observed. As you begin your relationship with a patient from another culture, plan to use the following basic transcultural communication techniques. First, approach and speak to a new patient slowly and wait for the patient to acknowledge you. Rushing can cause a patient to become fearful. Greet the patient respectfully. Address them with the title Mr. or Mrs. and try to pronounce their name correctly. Introduce yourself and help them with your name if they have a hard time pronouncing it. A quiet setting is conducive to communication. In a hospital, draw a curtain. Also, determine if the family should be there or not during the conversation. Do not interrupt the patient and avoid changing the subject in a drastic fashion. Furthermore, if the patient seems nervous, seat yourself so that you are physically below the patient. It can be perceived as being supportive and that the patient is in the driver's seat. Allow sufficient time and try not to appear rushed or anxious to leave. Explain the importance of the patient being honest about symptoms, especially if they appear fearful or nervous. Emphasize confidentiality. Listen to the words the patient uses to describe their symptoms. Use those terms to communicate with the patient and not medical jargon. Offer the opportunity to the patient to ask questions. Moreover, is to mirror the behavior of the patient. If they speak slowly, you should speak slowly. If the patient speaks in a low, calm tone, you should speak in a low, calm tone. Mirror the use of eye contact, especially when they come from another culture. Focus on a single experience mentioned by the patient and explore it in more detail. Once you are in a conversation, the patient will tend to open up more about their symptoms. Paraphrase in order to clarify statements. Seek validation from a patient that you understand what they are saying. Allow silence during the interview. This gives the patient time to think and speak. If the silence goes on for a long time, then pursue the issue by asking if the patient is concerned. If the patient looks angry while silent for a long time, ask them if they are upset. Finally, pay attention to nonverbal cues, especially when their words do not match their nonverbal cues. Pay attention to their posture, gestures, facial expressions, use of personal space, use of touch, and the frequency of eye contact.